Hello everyone, I'm Dr.Madhu Azad. Today we are going to discuss about diabetes, everything about diabetes. I have with me Dr. Camille Collin from France. She is specialist in diabetes, endocrinology and nutrition. So let's welcome Dr. Camille. Hi Dr. Camille.
Namaste. मैं Dr. Camille Collin हूँ. मैं फ्रांस में काम करती हूँ. I am specialist in diabetology, endocrinology and nutrition.
So first question, what is actually diabetes?
First of all, it's important to make a difference between diabetes type 1 and type 2. In the diabetes type 1, it's a specific autoimmune disease with a progressive destruction of cells producing insulin. In this video, we will talk specifically about diabetes type 2. Insulin resistance is the first step before diabetes type 2. It means that the pancreas has to produce more insulin to maintain a normal blood glucose level. After some time, we can observe like a burnout of pancreas, and at this time, blood glucose level starts to increase. This is the beginning of diabetes type 2. This is a chronic disease.
And is there any specific age group when diabetes happens?
Most of the time, it appears, this diabetes concerns adults after 40 or 50 years old. But the last year, we observed more young people with the increasing of obesity or overweight in the world.
Okay. So Dr. Camille, please tell what are the causes of diabetes? Why does it happen?
Diabetes type 2 is resulting of several factors. Indeed, there is some environmental factors like food, physical activity, overweight, obesity. And there is also some genetics factor, the family background, and all of these factors contribute to the appearance of the diabetes type 2.
Okay. How does a person know that he has diabetes? What are the symptoms of diabetes?
It can be difficult because at the first time of the disease, the symptoms can be very quiet, and sometimes patient may not feel anything. When the blood glucose level becomes too high, people can be thirsty, feel frequent need to urinate, lose weight, be feeling really tired, or to have a blurry vision.
Okay. So what to do?
The first line of treatment is to find a balance with the food habits and the physical activity.
Okay.
If this first step is not enough, we can use some treatment to help the body to reduce the blood glucose.
Okay. So diabetes is a lifestyle disorder. So what lifestyle modifications a person should do?
First of all is to take care about food. There is not specific diet for diabetes, like there is no forbidden food, no precise weight of food. The important point is to find a balance with the intake of starches, vegetables, protein. And most important is to be aware about food sensation. Like ask yourself, I am very hungry just before take lunch or dinner, and learn to listen sign of satiety, like listen when I'm not hungry anymore, when I have to stop to eat. Important point in the lifestyle is the physical activity. It's important to have regular physical activity, not necessarily very intensive sport like run for 20 kilometers or something like that, but to be regular, walk every day or swim, to be regular in what you do and find some activity you like and you want to keep on doing every day. to feel more active.
Okay.
I should just add that depends on your condition, like if you didn't make sports since a long time, and especially if you have diabetes, which is a cardiovascular risk factor, it's important to check your heart with a cardiologist before start again to practice some physical activity.
Okay, that's very important.
Yes.
So what is the treatment available?
If therapeutic lifestyle modification are not enough for the balance of the glucose, we can use several treatments to help pancreas to work. First line of treatment is biguanide. This class of treatment helps to decrease the insulin resistance. There is some other therapeutic option like sulfamide, SGLT2 inhibitors, GLP-1 analogs, or in the last step, when the pancreas doesn't work at all, we can use insulin injection.
Okay, right. So how long a person should take the treatment? Is it curable?
This question is a bit hard to answer because diabetes is a chronic disease and it's not curable like flu or bone break. It's something you have to learn to live with it. I should say it's a bit a challenge, to learn how to take care about your diabetes, but not to be obsessed with that. We know that sometimes, especially for people in obesity or overweight situation, if they lose some weight, we can hope to decrease the number of treatments, but to be honest, most of the time it's treatment people need to take the long life.
Okay. So what are the complications? Like the sugar level is too high, but the person is not feeling anything. So what can this high blood sugar level cause to this person?
Which is important to understand is that your glucose level is high in the blood, and the blood is the transport of everything in your body. Like oxygen, it's necessary, to help your body to work. If this glucose level is increasing, it's everywhere in the body, and it can create some damage of certain organs like heart, kidney, arteries, heart, etc. That's why it's very important to control the glucose level to avoid or make the prevention of this complication. Moreover, we advise people to make regular checkup about this potential complication by see an ophthalmologist every year, make blood analysis, renal analysis every year, and to see a cardiologist regularly.
Okay, so a person must visit a doctor regularly.
Yes,
so that
of
he can
course.
check whether his blood sugar level is controlled or not.
Yeah.
Okay, so the person has started treatment. Then how to know that the diabetes is under control?
We recommend to make a blood analysis every 3 months, and we use HbA1c. In fact, it's a glycosylated part of hemoglobin, and it can give us the mean of the glucose level of the 3 last months, because the duration life of hemoglobin is 3 months. Of the patient profile, like if he's very old, if he has some nephrologic disease, if he has some heart disease. And we know, like for weak people or people who has a lot of other disease, we are a bit more large in the objective in the goal of treatment, because hypoglycemia can be dangerous for them.
Okay. And what are the diseases associated with diabetes?
As I said previously, diabetes type 2 is considered like a cardiovascular risk factor. It's important to detect the other disease associated to with high cardiovascular risk factor, like hypertension, dyslipidemia, sleep apnea syndrome. So very regularly we make the checkup of this disease to detect them, their appearance, and to try to control them to reduce the risk factor. And I should say too that for smokers people, we advise them to quit and to stop smoking.
Okay, that's a very good point. I guess we have covered all the points regarding diabetes. And if you have any questions, you can comment in the comment box. Subscribe for more videos like this. And I should thank Dr. Camille for this wonderful information. Thank you so much. Hope people will get benefit by this. In the next video, I will discuss the role of homeopathy in diabetes. Thank you so much. Bye-bye. Stay happy and stay healthy. Bye, Dr. Camille. Thank you.